So I've logged in over here to, can you all still see my screen?
Yes.
Okay,
Yes.
wonderful. So I've logged into the uapps.ulh.org. So I'm here in Citrix. And today we're going to use the mock because that's our test environment. But when you first log in, you would see all these different icons. The one you'll want to use is PowerChart, and P is our production or like live environment. So PowerChart is what we're going to use. I'm just using our test environment for the training today. And I'm going to be logging in as a nurse. So when I first log in, it's going to take me to Care Compass, but the two tools that I'm looking for are actually going to be up here in my toolbar, and they're going to be called Mass Vaccination Check-in and Administration. Now, a lot of the sites have it set up as two different people. So one person's doing like the check-in, check-out, and the other person is doing the administration piece. So that's why, and that's how Cerner has it built out, is into two different buttons. So there are two different tools that we'll use. The reason I have my toolbar set up like this is if you have you can move these bars around. These two buttons are at the very end of your toolbar, but if you do have them scrunched or you're on a laptop or something that doesn't have a whole lot of screen space, you may actually have to find the two little dots with the down arrow and find your mass vaccination tools. If try as you may, you cannot find those two little dots, you can actually go up to the view option in your toolbar and you'll see those two tools as well. So we're going to start with check-in. And the first thing you'll want to do is to search your location. Unfortunately, it's not a true contains search, so we can't just type in COVID vaccine and find all of our clinics. We actually have to give a prefix to it. So like for Mary and Elizabeth, it's MEH COVID, and we want the vaccine site. One thing that's another little thing that's a little tricky or may seem a little off with the vaccine sites is that because of the simplicity of the tool and the quick build of it, we could only associate one patient encounter type to this check-in tool. So to make everything just a little more simple, we put all of the vaccine sites under Jewish hospitals. So Mary and Elizabeth COVID vaccine, if I were to type in ULH COVID vaccine, you can see that they're all under Jewish hospital. So I'm going to choose that MEH COVID location, COVID vaccine location, and hit save. Now, as long as you don't refresh your screen, your location will stay set for as long as you're logged in. But if you did refresh, you would have to search for your location again. Next, we're going to search for a patient. When you hit search patient, you'll get to this patient search window. Now, I have a PHIN number today, but you will probably have their first and last name. When you do search for a first and last name, we also ask that you do their birth date as well, because just like when I do this MMM provider, there's multiple patients that'll match that name, and we want to make sure that we're choosing the right patient. When you, or employee in this case, when you do the search, any persons in the system that match that name will end up at the top. And then once you've found the person you want, you'll look down at the bottom here to find their appropriate encounter. So I'm going to search for the patient that I actually want. The encounter type that you're looking for is going to be at that Jewish hospital facility. That outpatient quick D is the encounter type, but the real key here is this COVID vaccine med service. That's going to be the piece that really stands out. So I've chosen my patient, I've chosen my encounter, and I hit OK. Once my computer wants to work, this is where I will add the immunization. Now, we've already kind of been playing with this patient, so you'll see they already have the COVID-19 in their required immunizations down here. But most patients or employees, when you first go to check them in, will not have that. So we'll click Add Immunization. You want to select your COVID vaccine and then hit Select. So again, we found our location, we found our patient, we went down to the immunization section down here, we hit Add Immunization, chose our COVID-19, and hit Select. So now we have the vaccines listed that we're getting ready to order. So we have COVID-19, check mark, we'll hit Order and check in. At the Mary and Elizabeth site, you all will be using Moderna, is what I've been told. But our pharmacy team has been very kind, and instead of putting this big, long technical name for our vaccines, they did put the manufacturer name. So you'll choose which vaccine that you want to administer. The order details are already filled out to you. We'll want to click to print a summary, that just saves us another little step down the road, and we'll hit Sign. So we had said add vaccine, we want to do COVID-19, clicked order and check in, choosing our Moderna, we want to do a print summary, and hit sign. The physician that we're ordering all these vaccines under is Dr. Schoaf. I did put that on the tip sheets that I sent out. I'm not sure if everyone got the tip sheet, so I'll send it out to this group after we're done as well. And we want to use the communication type of order requiring provider signature. So one of the things that is mandated from, I'm not sure from CDC or state level or where this come from, but that the order does need to be signed. When we kind of talked about it as a group, we said, well, it's not really a phone or verbal order because the provider isn't, standing right there giving that order. It's not a policy protocol, and it's not discontinuing. So we chose to go with this generic order requiring provider signature. So click OK. And you will get this vaccine summary sheet that pops up. This sheet kind of acts in place of the patient's armband. So instead of printing out armbands to be able to scan the medications and scan your patient, we'll actually get this vaccine summary sheet. The QR code that's over here on the right-hand side is that quote-unquote armband, and then you can see that the COVID-19 was ordered. You would print this with the little printer button and then choose the local printer that you have at the site. Now, one thing to note, if you do not get a QR code that generates, that's not a work stoppage. The reason a QR code may not generate is because the patient is registered to the wrong location. Maybe the person doing registration wasn't paying close attention and put them in at the Jewish hospital site instead of the Mary and Elizabeth site. Well, when you go to check them in, it kind of creates them a new encounter, which is completely fine. You can still administer vaccine and it'll, information will go to the state. It's all on their profile, but it won't create that QR code because that encounter won't have a FIN number. So it's not a work stoppage. It's just a kind of a workflow note. So I'm going to close this out. I don't have a scanner with me today, so we're just going to kind of walk through the scanning processes. But you would normally print this out, hand it to your patient or employee, and then they would take that with them for when they get their vaccine administered. Another key to show that your patient has truly been checked in and that your vaccine has been ordered is that COVID-19 vaccine moves underneath pending administrations. If you did forget to click the print summary button when you went to order, you can always click it from this bottom left-hand corner as well, and it'll give you that exact same page. So we've checked our patient in, and then they're moving on to the administration person. Now, the first time that you log in, you're going to have to create yourself a patient list, and there is a tip sheet on how to create this list. Once it is created once, you don't have to create it again. You would go to list maintenance. You're going to do a new list. You want it to be location based. And then we're going to hit the plus sign next to locations and then plus sign next to Jewish hospital until we find all these nursing units. And what we are looking for, of course, is that MEH COVID vaccine site. Scroll too much. It is alphabetical order. And I'm going to throw a number at the end because I've done this list a couple of times and it won't let you save the same list with the same name. But you should be able to just put a check mark next to the COVID vaccine MEH site and then hit finish. To be able to see it on your administration page or anywhere you see lists, you'll want to move it over from available to your active list and then you'll hit OK. Once you do that, you'll select your patient list. And we're really fortunate here. We have a nice short list for training. But let's say we had a longer list like this, or maybe a list with 100 patients like you might see after a couple of days. If you're trying to find someone on your list, there's two different things you can do. One thing I like to do is that you can sort these columns by like patient name or task. I like to sort it by task because you can see that when the vaccine is ordered or however many tasks there are, it'll bring those to the top of the list. The other thing you can do is use this patient search in the right-hand side, kind of in the middle of the page, and you can start typing for the patient name that you're getting ready to administer to, and it'll kind of filter them out. So I'm going to go back to my Mary and Elizabeth COVID vaccine site. One thing that's different between our test environment versus our real environment is that in test we had two different tabs, one for scanning and one for manual administration. We, for the real world, have decided to smush those together, so you'll see all these columns on the same page. If you did need to do a manual administration of the vaccine and you didn't want to go through all of the scanning steps, you could click on the name of the vaccine, find the three little dots, and hit Document. And it'll bring you to a vaccine administration page. All of the yellow fields are required fields, so we need the lot number, the manufacturer. What's nice about that, although there are lots of manufacturers listed here, if you were to start typing, whether you're doing Pfizer or Moderna, it'll pop you, if you kind of start, even though it's a drop-down list, it'll kind of pop you to that spot in the list if you start typing that manufacturer name, so you don't have to scroll all the way through it. For the expiration date, we do want the manufacturer expiration date of the vial. That will be printed on the little label. Originally, we were putting best use by date, but then the state came back and said they wanted the actual manufacturing date of the product expiration. So I think right now it's sometime in April, May is what that expiration date is, and then finally just the site. So I'm not going to document this here because I just want to step through the scanning portion as well. So from the scanning, if you have scanners available and are able to do the scanning methods, we would actually find your patient name and hit Launch. You would scan the wristband. I'm saying no scanner available. And then you would scan your medication. Once you get here, you have this yellow box, which is the required, means there's additional required documentation, so you'll click on that box. One nice thing when you do scan is that the manufacturer does auto-populate into the box, so that is one less thing that you have to do. You will still have to manually enter the lot number and expiration date, and then, of course, where you administered it. So as soon as it pops up, we'll go ahead and administer the vaccine. Maybe. I promise it does not take this long in the real world. I've got Moderna. My expiration date is, I'm going to say 04/15/2021, and we gave this in our left. And then click OK. Once you're done documenting the required details, that's when you hit sign in the bottom right-hand corner. If you were to refresh this page, you'll see that, forgot to point this out, this column of tasks goes from 1 of 1 administered, and then if I go back to my manual administration, I no longer have any tasks listed. So you've given the patient their vaccine. They go to sit wherever is the designated area and wait their appropriate 15 to 30 minutes based on their past medical history. And then they say, okay, hey, I'm good. I'm not having any reactions. They go back to their check-in person and they say, hey, I'm ready to be checked out. So that person will have to search for their patient again, bring them up, and at this point, we would simply hit checkout. You can see that their pending administrations is gone. If you went to history, you could see that they received the vaccine. This history tab is going to be really useful once you start doing second doses, so you can just confirm that that is what they received the first time, and then we'll hit checkout. If you wanted to do a quick check just to make sure that they are checked out, when I go to my vaccine list, I'll see that they're no longer on my list. So that's the importance of checking out. It kind of keeps the list cleaned up, especially for those administrators, and it just almost it discharges them and close out their encounter for that visit. So that was a lot of information on a pretty quick tool. What questions do you all have? Was there anything you needed to see additionally? I know a lot of it is just getting out there and doing it in practice.
I don't have any more questions. That was very informative. Thank you.
You're welcome. I was going to say, if you were on the call yesterday, I know it wasn't quite as quite as controlled. We were having lots of